Hello, this is Dr. Jaideep Chaudhary with Academics in Nutshell, and the topic is a threatening neurological condition, acute encephalitic syndrome. For diagnosis of acute encephalitic syndrome, fever of acute onset is a constant feature, along with a change in mental status like irritability, confusion, disorientation, coma, and or a new onset of seizure at any age and at any time of the year is diagnostic of acute encephalitic syndrome. There may be other early signs like irritability, somnolence, and abnormal behavior. Japanese encephalitis remains an important cause of acute encephalitic syndrome, but there are other viruses like the enteroviruses, dengue, herpes, varicella, which may also cause acute encephalitic syndrome. Among the other causes, crop typhus has come out to be a very important and common cause. Then there are bacterial, acute TBM, malaria, protozoal, sometimes toxin, chemicals also as cause of acute encephalitic syndrome. But the major cause of AES, both sporadic and outbreak, remains Japanese encephalitis. Probably the next common comes as the scrub typhus. Then there are various viruses, and also among bacteria, streptopneumoniae is a cause of AES. Based on this, when do we suspect Japanese encephalitis, which is the commonest cause? Usually it's children in the age group of 2 to 15 years belonging to a rural area or an area with high mosquito density even in urban population. Particularly during monsoon and post-monsoon, when there is waterlogging, the fields are flooded, and usually when there is proximity to cattle, pigs and horses. And the presenting features are fever, altered sensorium and evolving CNS illness. JE, the ideal condition is a confirmed JE when the suspected case is lab confirmed, but there may be a probable JE when a suspected case is in close geographical and having temporal relationship with lab confirmed JE, particularly in an outbreak situation. There may be AES to other than JE, where the etiology other than JE has been identified, like scrub typhus or other viruses like herpes. But many a times it's AES due to unknown agent, where the case is suspected with features of AES but which no diagnostic test is performed, or the test performed but etiology has not been identified. For diagnosing JE or acute encephalitic syndrome, presence of IgM antibody either in serum or commonly in CSF is the commonest diagnostic method. There may be other methods like fourfold rise in paired sera through IgM or IgG, ELISA or virus neutralization test, and there are various other tests which are not routinely done. IgM antibody is the commonest. MRI is not diagnostic, but if done, the lesions are mainly limited to the thalami, the basal ganglia and midbrain. To sum up, AES is definitely an emergency and a serious neurological emergency, and JE as the cause should be suspected in endemic region. JE is the commonest but definitely not the only cause, because we have to look beyond JE sometimes. And for JE, effective vaccination is available. Unfortunately, for most of the causes of AES, supportive care is the mainstay of treatment, and few conditions like herpes may be treated with acyclovir, bacterial infection by antibiotics, malarial with antimalarials of scrub typhus with doxycycline. Otherwise, a strong suspicion and awareness of acute encephalitic syndrome is essential. Thank you.